Okay, not that bad. Not
But
that
for
bad,
men, it's
so-
quite traumatic.
Oh, you use that for men?
Yes.
Oh! How much of that
Goes into-
enters? That's what I want to know.
Just a little bit, maybe 1 or 2 cm. Actually, they wash their private part very often. So other than, no, please don't do it
Not to
Not
wash
to
the
wash the
inside?
inside the
Inside.
vagina, because there are people who actually wash it.
Hey guys, it's Mike.
And it's Sonia. Welcome to We Need to Talk About This.
And today we have with us Dr. Fiona. Hi.
Hello?
Yeah, you know what? I think today's episode is going to be a little bit challenging because it's kind of private information sometimes that we don't want to put out there, right?
That's right, yeah.
But to be honest, Mike, we've been talking about a lot of difficult things on our show so far.
we sure have so many things that are just
Yeah.
kind of hard to talk about. Yeah.
So let's get straight into it. Dr. Fiona, can you tell us a bit more? We got a chart here today. We got some containers here today. What's going on?
And if you're eating lunch at home,
Forget it.
Thank you for having me. So we'll talk a bit about vaginal discharge. As we know, right, during a female's menstrual cycle, it is quite normal to have some form of a discharge. But I think the color, the consistency, and whether there are any associated symptoms, it does matter. And we really need to talk about it because if there's any abnormalities, please go and see a specialist.
sure.
Yeah. So from this chart, you can see that for a normal female, during their menstrual cycle, they will have some form of healthy discharge, which should be transparent or maybe slightly white, and it should be relatively clear with no associated symptoms such as pain or itch.
Okay,
So the
so-
moment there's any accompanying symptoms, you know that something's up.
Yes, something is up, especially when it looks a bit abnormal, like a bit greenish, a bit thick with the consistency, it's a bit like curd. And
Yeah.
it's associated with a bit of itch around the genitals or painful, especially during intercourse, then yes, there are some abnormalities going on.
So speaking of consistency, while you're on that note, we actually have over here on this table some props that resemble samples.
Resemble.
Yes.
Yeah, resemble samples. So is there anything here that might be in reference to what you're talking about?
Okay, on the extreme left, right, that should be how a normal vaginal discharge look like.
A
It's
little yellowish.
Yeah.
a little yellowish, a little bit transparent, and it should be watery.
Okay. It almost looks like urine.
Yes, that's right. But
Yeah.
okay, the thing about that is that if there is urine coming out from the vagina, that's absolutely abnormal.
Oh, okay, that's another condition altogether.
Yes, that's another condition altogether.
Okay.
Then the one next to it will be a bit thicker, a bit whitish, and a bit more curd-like. So just before menstruation, sometimes we do have this kind of discharge. That's quite normal. But if it happens throughout the whole menstrual cycle and it's accompanied by a itch or some discomfort,
Pain.
then it can also be a little bit of infection. For example, an yeast infection, which is very, very common. So for yeast infection, usually patients have it after they had a urinary tract infection. They took some antibiotics and that upset the natural pH of the vagina and they end up with a yeast infection. Although, of course, yeast infection can happen anytime as well.
And does it get worse? Like, does the itching, the burning sensation or whatever get worse?
It does, you know. Sometimes if it gets worse, right, it might progress onto greenish or yellowish discharge.
Oh,
The
no,
one
which
on
is-
the third one.
Oh, man, okay.
Gee, what can result from this?
Most of the time, it's some form of infection. It can be a bacterial infection. It can be a fungal infection. For very bad cases, like sexually transmitted conditions, it can also be some form of a parasite.
And if untreated, this could be a serious problem.
Yes.
Yeah.
If it's untreated, number one, it can lead to a lot of symptoms. For example, burning when you pass urine. It's itchy.
Right.
And left untreated, it can lead to quite severe consequences in some patients. For example, it can lead to very bad pelvic infection. I think most of the time, some people are not too sure. Even when they have abnormal discharge, they will just leave it.
And hope that it goes away or
Correct.
something.
But if the color has shades of brown or red, you know that, there must be some abnormalities there, like growth, like cervical infection, bleeding from a polyp, or the worst kind of situation is when the patient has cancer.
Oh.
And
So
yeah.
I'm just going to also fit this right in because naturally people's first reaction to any of these symptoms, I mean, obviously not so severe, would be to go to like a drugstore or something and get like
Yes.
a wash or,
Yes.
does that even help or work at all?
I don't think we should wash it that area too much because most of the time when the patients see a urologist,
Yeah.
they will come with urinary tract infection, So when I speak to them, they will say, oh, actually they wash their private part very often. So I told them, no, please don't do it.
So it's not a good thing.
It's not a good thing because you wash away the natural moisture and the pH changes. So whatever protective layer that we have and protective
gone.
bacteria, yes, it's gone.
Well, we've heard about like Gwyneth Paltrow and steaming. Is
Yes.
that a thing?
The
Is
V,
that,
yes, I just read about it.
Oh, you did?
Yeah, some V steaming, right?
is that good, bad?
Not proven yet.
It's not proven yet.
You just stay away from it, right?
But at least that is not like washing away.
Okay, washing is just getting rid
Yeah.
of that natural moisture.
Yes,
which is
correct.
Bad. Yeah.
And when patients have infection, they have a tendency to keep washing it again and again.
Yeah.
I think that's not too healthy.
That's the thing. It could also obstruct your life, right? You know what I mean? It could really affect
Hindrance,
everything, like
yeah.
your sex life, your
Debilitating.
everything.
Peeing
Yeah.
and everything, yes.
So what can we do then? What is the best way to cleanse the area and take care of it?
Most of the time, we will just advise patients to clean when they are showering and not to wash with any harsh soap and any, those perfumed products. I
Yeah.
think that's a no-no.
Yeah.
We just wash with water. Yeah. I think that's
Okay.
quite safe.
Okay, okay,
And
fair
not
enough.
to wash the inside.
Yeah. Oh, not to. Yeah. Okay.
Not to
Not
wash
to
the
wash the
inside?
Inside the
Inside.
vagina. Because there are people who actually wash it.
I'm curious also though, like we talk about, discharge in women. What about men? I mean, are we going there or no? Like,
Let's go there.
are we
Okay.
going there? Okay.
So usually for men, most of the time they do not have any discharge. But when they do have some form of discharge, if it's like when they're aroused, they get a bit of seminal emission. I think that's quite normal, especially for the younger guys. But if it happens, frequently, and it's accompanied by burning sensation when they pee,
So
That's not
when
right.
you say discharge frequently, you're talking about even semen, if that's happening frequently. Does that happen frequently?
for the seminal emission, it's definitely semen. But for discharge, it's not so much of a semen.
Yeah.
It's a bit of a sticky, transparent
Does
fluid
it
that comes out.
resemble anything here?
Yeah, it
Okay.
resembles the one.
Okay.
Okay, so it's clear.
It's clear,
Yeah.
but it's accompanied by itch and
Okay.
pain when they pee.
All
Or
right.
when they ejaculate, we should see a urologist.
Okay.
Because most of the time, when that happens, it's a sexually transmitted disease.
Oh,
All right.
dear. Wait, what about the last one over here? I realized we haven't addressed it just yet.
For this discharge, it look more like semen.
So it's kind of normal. This
It's
is
kind
just
of
what
normal, yeah.
normal.
Yeah, that looks all good to me.
Yeah.
Yes.
Thank you for your professional input, Mike. I think that was very
Oh man, I can
useful.
tell you.
Oh man. Okay, so I guess when it comes to both men and women, we are both susceptible to certain things out there, right? So you use something like a Q-tip to get a sample and then
Yes.
put it in the test and then
Yes,
you're
we
off.
send it off to the lab.
Okay.
So for those people who have not seen it before, we do use a longer swab. It looks
one-
exactly like a Q-tip.
Okay.
Okay, not that bad. Not
But
that
for
bad,
men, it's
so-
quite traumatic.
Oh, you use that for men?
Yes.
Oh.
We use that for both pap smear. We use it for a lot of purposes.
How much of that
Goes in.
enters? That's what I want to know.
Just a little bit, maybe 1 or 2 cm.
Still, it's
Yeah, it's very painful.
Yeah, okay.
I just cringed and clenched like thinking about it.
Yeah, yeah.
But it's got to be done. You rather do that and experience a few seconds of pain rather than live with something that might be life-threatening almost, right?
For sure.
How exactly do you treat these things? Like we haven't exactly talked about that yet.
For the female patients, if they have abnormal vaginal discharge and it's accompanied by pain or itch, right? Usually we give them a pessary. Okay, it's a medication that we insert into the vagina, and that will treat the problem.
What about oral medication or anything else that patients can take?
Sometimes for very bad infections, we need oral medications.
Antibiotics?
Yes,
Right.
antibiotics for bacterial. But if the swab results come back as other kind of fungus or parasites, right? Then we need to have medication targeted at this.
The
No,
fungus,
yes,
right?
yeah, that's
Targeting
right.
it. Okay.
What about for men then? Is it the same kind of treatment process or?
For men, it's a bit different. Usually, when they have abnormal penile discharge, it's usually STD. So
Okay.
they will get their antibiotics, either one shot, or they can have a course of up to 2 weeks. Yeah, to treat
What
it
would be a
properly.
typical STD for this kind of, for discharge?
For the men, right, usually it's either chlamydia or gonorrhea.
Okay.
This is what usually we test for.
And those are
very
curable.
common. Yeah, curable as well. Common
Yes, it's
and
curable. Yes.
Okay, yeah. No,
Okay.
but that's good to know because I think
Yeah.
some people they're deterred to go to the doctor. They're scared, right? Because they don't know what's going on there. And it's kind of often a bit of an embarrassing moment as well.
That's right.
But Dr. Fiona is very gentle and kind. She's not gonna, make it difficult for you. Look at her. Like,
She's not
all
going to use
good.
the swab if she doesn't have to, right?
Yeah. Thank you so much for being here with us, Dr. Fiona. I think, it was very necessary for us to address these embarrassing situations.
Absolutely, absolutely. Okay, guys, we need to talk about this. Here you have it. Thanks so much, Dr. Fiona, and bye, everybody.
If you like this content and you want more,
Then be sure to catch the main series, Let's Talk About Health, on Channel 5 and MeWatch.